Welcome, everybody. This is a super exciting event. So as Paul mentioned earlier, this is the first time we're partnering with MedTech World, and super excited to be doing it for our 2025 Accelerator cohort. So you're going to be hearing today not just from our US MedTech Innovator Program companies, but also our Asia Pacific companies and Enterprise Singapore US Market Access companies. So got a really great showcase across 6 different clinical themes for you today. I don't want to take up more of your time because I know you guys are here to watch these incredible innovators and entrepreneurs. Our first session this morning is going to be themed around orthopedics, rehab, and surgical tools. So anything that, helps you stay humorous, we're going to start with. So let's first bring to the stage Joe Lin from Aesclepius, Technologies. So looking forward to hearing from them.
Good morning, everyone. It's an honor to bat Lee off. Thank you. I'm Joe Lin. I'm the COO and co-founder of Aesclepius Corporation. And we aim to make a better tool and a better outcome for the surgical of plantar plate repair. So what is plantar plate tear? Plantar plate is a ligament at the bottom of your foot. If you can see it, that little pink band of tissue at the bottom of the stigmatic, that's your plantar plate. What happens when it's torn? It's going to hurt. It causes a lot of pain and deformity, just like these photos show. So you might have already seen some of these cases around with people you know. Okay. I'll play, let's see. Let's see. Doesn't do it. Anyway, I'll just describe it. So what we have come up here is a clamp-and-cinch system. The clamp allows the surgeon to grip securely onto the toe, manipulate the toe to operate in a very tight joint space. As you know, in the foot there are a lot of little tiny bones, and this system allows the surgeon to perform this secure gripping manipulation. On board of the clamp, there are actually 2 double-barrel drill guides that allow the surgeon to do a consistent drilling of the bone tunnel where the surgeon is going to pass the suture. And lastly came the suture cinch system, which has a curved nylon loop that loops back up onto the curved space for the surgeon to pass the suture from the top. Why is this important? So you can imagine you have something torn at the bottom of your foot, but they do not do the surgery from the bottom. Why is that? Because after your wound heals, you're going to have scar formation and scar at the bottom of your foot. So every day you walk on it, it's still going to hurt. So they do the surgery to attach something at the bottom from the top, and that comes where the technical difficulties. So what do surgeons do nowadays? They actually have their assistant put in 2K wire, pry it open, and then manipulate that way. And they have to actually do all the drilling freehand. So we come up with this tool to give them a much easier way to do their surgery and be able to produce a more consistent and efficient result. Okay. Our system is actually initially launched already. It's fully manufactured and tested. We are FDA cleared. As you can see, this is the photo of the product. The market itself, it is a bit of a niche market, but it's growing rapidly. A lot of the cases are actually underdiagnosed, and the surgeons just try some passive treatment to alleviate and maintain the status quo. But in order to really fix the problem, you still do require surgery. So that's a picture of my handsome partner, Adam. We are graduate school buddies. We decided, hey, all the basic research that we have done all the years, right? We want to do something tangible and meaningful that can help our patients and help the public. So we turned entrepreneur and decided to embark on this project. Okay, and lastly, I'd like to depart with this slide here. Is for anybody who's a fan of the MedTech series, right? Don Draper, it's useless to be a creator unless you can sell what you create. And that's where the investor comes in. We can create something that we need your help to get it to the market and to the public. Thank you very much for your time.